Hello everybody. It is my pleasure to give you this talk on family planning in Fabry disease. First of all, I would like to thank the Fabry International Network for inviting me. I'm Torra. I'm an adult nephrologist working in Barcelona on genetic kidney diseases. A lot has changed since Dr. Mendel in the 19th century discovered that some traits were inherited through generations in a single family. Nowadays, in the 21st century, the technology allows us to sequence the whole genome in a very quickly manner. So we have access to genetic testing, and I would like to highlight every patient with a hereditary disease has the right to receive genetic counseling. And what is exactly genetic counseling? It means education and guidance offered by professional advisors in order to help people make informed decisions about their health, their children's health, or their pregnancies based on genetic knowledge. So, genetic counseling promotes informed decisions by involved family members, explains the pattern of inheritance, provides explanations about the disease, its diagnosis, treatment, and prognosis, and explains alternatives regarding passing over the disease to new generations. Regarding informed consent for genetic testing, which is something that we as professionals must always obtain from you, this informed consent must contain the aim of the test and its consequences, the place where the test will be performed, the destiny of the DNA sample, who will have access to the results, the possibility of unintended secondary findings, the implications for relatives, and the commitment to provide genetic counseling. There are some national laws regulating genetic testing, especially at the US. This is, as you may all know, the Genetic Information Non-Discrimination Act of 2008, and it prevents the potential misuse of genetic information to discriminate in health insurance and employment. It is very important for us to listen to patients, and I liked very much this sentence from an article published in the Clinical JSON 1 year ago. It said, if I did not know about genetic testing, I would have had children and perhaps unknowingly passed on the disease that could diminish their quality of life. Genetic testing is so important because it is not just my child's life that is involved, but also anyone involved in caring for a child with a diagnosed kidney disease. So it is very important to know what you feel and how do you feel about this. Fabry disease is an X-linked disorder, and as you all may know, when there's a female having the disease, she may have affected male, like 50% of them, or affected female. You know, they're less affected than males, but even though they're patients also. And regarding males, because the mutation is in the X chromosome, they will have all daughters having the disease because the man passes the X chromosome to the daughters, but none of the sons will have the disease because the male passes the Y chromosome, which has not the mutation. So what are the reproductive options? One of them is doing nothing and accept the percentage of passing over the disease, like depending on what you mean. I mean, a woman has 25% of having an affected boy, 25% of having an affected girl. A man has 0% of having an affected boy and 100% of having an affected female. So this is one choice which we must respect because it's the patient's decision. So doing nothing and accept this percentage of passing over the disease. Insemination or ovum donation is another option. Prenatal testing and Preimplantation testing. For the latter two, we need for sure the previous identification of the disease causing mutation. It is absolutely mandatory, otherwise we cannot offer these techniques. Artificial insemination is quite a simple procedure, much simpler than ovum donation. It's a deposit of a sperm unnaturally in the female reproductive system in order to achieve a gestation. it is a low complexity technique. It's possible to do it in the consultation, and it gives rise to genetically unrelated children, of course, because the sperm comes from a donor. So the requirements for donors, anonymous donors, is to rule out infectious or genetic conditions and to assess some phenotypic and psychological features. And regarding females, they need to have permeable fallopian tubes. So this is an easy procedure, but of course the children won't be genetically related to the father. And it's only useful when it is the father who has the disease. Otherwise, if it is the mother, then you should go for the ovo donation. Prenatal diagnosis. This is something different. It consists in a regular pregnancy, and when the mother is like 9-12 weeks of pregnancy, we take a chorionic villus biopsy, which is not the fetus, it's close by, and it has the same DNA that the fetus. So we analyze this sample, and if it carries the mutation, then we proceed with termination of pregnancy. Otherwise, if the fetus has not the mutation, or maybe in the case of Fabry disease, it is a girl and you do not mind having a female with the disease, then the pregnancy continues. The last technique that we can offer is preimplantation genetic testing. It consists of in vitro fertilization, and then when we have the embryos, it can be different stages, but like 6-8 cells. We take one, or maybe if it's a little bit later, we take 2 or 3 cells. Then we analyze these cells, and if the embryo has the mutation for that family, the same mutation than the father or mother, then we do not use them. But if they don't have the mutation, we proceed to implantate the disease-free embryos into the uterus. Of course, this means going into a whole IVF process with all hormone treatment and sedation to obtain the eggs, and after that, after the in vitro fertilization and selection of the embryos, again, some sedation to transfer the embryos. It is not, let's say, an easy and always effective technique. The number we may obtain from an in vitro fertilization may be like 10-15 eggs, which is very nice and quite a good number, but maybe only we have like 6 zygotes. They will not all fertilize. The number of embryos with correct evolution may be like 4, but maybe only half of them will have no mutation. So finally, the number of implanted embryos is very much reduced. And finally, the pregnancy rate is like 30-40%. And also, according to the guidelines we do, is to do some amniotic sample analysis afterwards, just to confirm. There are some ethical issues regarding this procedure. For example, in Spain, it is approved for severe, early onset, non-susceptible to treatment diseases. I have to say that Fabry disease is accepted. And also, according to religion and beliefs of the couple, there may be different opinions, that they are all very respectful. Finally, the patients may require psychological support, and it is especially indicated when there's anxiety in one of both members that makes foresee hasty decisions, when information has caused traumatic situation affecting individuals or the relationship, when there's emotional fragility, low level of understanding, or previous family instability. I will show you finally some cases. This is a 32-year-old male recently diagnosed with classical Fabry disease, and he has fertility problems. So he wanted to have a disease-free offspring, and he chose artificial insemination from donor, and he has a healthy boy. This is a 33-year-old male diagnosed with classical Fabry at 17 years of age. and he wishes to have disease-free males and accepts affected females. Sorry, it is a female. And then she wanted prenatal diagnosis. She had one pregnancy and it was a healthy boy. So she had a healthy boy, but in the second pregnancy, the chorionic villus sample showed an affected male. But she chose to go on and she has now an affected male. So even she said she did this procedure to interrupt the pregnancy. When the time came, she didn't want to. So it's not compulsory, of course, but should be consequent with the choice. And finally, this is a 34 years old female with classical Fabry disease, and she also wishes to have disease-free offspring. Then we analyze. She opted for in vitro fertilization with Preimplantation genetic testing, and with just one course of hormone treatment and so on, she had a lot of embryos, which allowed her to have twins in a first pregnancy, then a girl in a second pregnancy, and another girl in a third pregnancy. So she has 4 kids, healthy, all of them healthy kids. So the take-home messages are that all patients have the right to receive genetic counseling. Genetic testing is essential to perform prenatal diagnosis or PGT, and patients with a genetic condition such as Fabry disease should be empowered to choose a reproductive option. Finally, I would like to thank all the people in my place. Thank you very much for your attention. I will be happy to take any questions.